Hello everyone, and welcome to our virtual training program. In this module, we will be discussing occupational balance. Occupational balance is one of the most important terms used in occupational therapy. Similar to work-life balance, or a balanced lifestyle, occupational balance entails engaging in the amount and variety of activities to support health and well-being. In fact, within the field of occupational therapy, the term occupation or occupational does not refer to work or someone's profession. Rather, it refers to everyday activities, like self-care, household management, or caring for someone. Occupational balance can be assessed from three distinct points of view. First, it can be assessed based on the balance of your engagement with physical, mental, restful, and sleep occupations. Second, occupational balance can be evaluated based on your engagement in occupations that have different characteristics, like reading a book versus going to a concert. And third, occupational balance can be assessed based on the amount of time you spend engaging in various occupations on a daily basis. Although occupational balance can be achieved when these three criteria are met in a balanced manner, it is important to note that occupational balance is subjective, and each individual experiences it in a unique way. This means that you decide what an occupationally balanced life looks like to you, based on your experiences and your responsibilities. It is also important to note that occupational balance is not stationary. It is a continuous process of evaluation that changes throughout your life. As your goals, priorities, abilities, obligations, and aspirations change, so will your personal definition of occupational balance. But why is occupational balance important? Several studies have been conducted to link occupational balance with overall health and well-being. A study done at the University of South Australia found that there is a direct link between these two. In fact, a large percentage of the people in this study who reported being in excellent health also said that they were satisfied with the distribution of occupations in their daily life. On the opposite end of occupational balance is occupational imbalance, which can occur as a result of an individual not having enough occupations to engage in, or having too many occupations to keep up with, often experienced among caregivers of adults with brain injury or with neurodegenerative conditions. While the first situation, in which individuals do not have enough occupations to engage in, results in boredom, the second results in burnout, also commonly experienced among caregivers. Both of these scenarios can result in occupational imbalance. What are the consequences of occupational imbalance? Regardless of the source, occupational imbalance can result in high levels of stress, as well as negative impacts on health and well-being. Another possible consequence of occupational imbalance are engagement in activities that can negatively affect health, like smoking or overdrinking. So, overall, occupational balance should be a goal for everyone, and especially for caregivers. But how do I know if I am experiencing occupational imbalance? Here are some signs of occupational imbalance. You have a to-do list that is never ending. You are extremely busy and can't seem to fully accomplish your tasks or fulfill your responsibilities. You are experiencing increased stress levels because of burnout and lack of sleep. You have physical symptoms such as headache, chest pain, and even dizziness. And lastly, you have difficulty concentrating and may lose focus and direction. In the following slides, I would like to share with you a helpful resource that you may use to reflect on your current level of occupational balance. There are 8 questions in total. Please feel free to reflect on the questions throughout the presentation. However, if you need more time, please refer to our other resources for a written document of this assessment, which you may print out and use whenever you prefer. The first question is, on a scale of 1 through 6, where 1 is poor health and 6 is excellent health, rate your current level of health and well-being. The second part of this assessment includes a table, through which you can rate your current level of participation in each category of occupations. There are 4 categories. Physical occupations refers to occupations which involve physical activity, like engaging in your favorite form of exercise. The second is mental occupations, which involve mental activities, like engaging in your favorite cognitive activities, such as reading or doing puzzles. The third is restful occupations, which involve any activity that you may find relaxing. Examples are meditating, doing yoga, going for a walk, or watching your favorite movie. And last is sleep. The third part of this assessment includes rating how satisfied you are with your current balance of occupations on a scale from 1 through 6. 1 is extremely unsatisfied and 6 is extremely satisfied. The fourth part of this assessment includes rating your ideal level of participation in each of the categories of occupations presented in the table before. The fifth part is yet another table to compare the answers you gave in sections 2 and 4. This will help you visualize the difference between where you are now and where you want to be. Next, answer the following. In your opinion, what are the top 3 things that are stopping you from engaging in your occupations the way you want to? The following question is, in your opinion, which area, physical, mental, restful, or sleep, will be easiest for you to take steps toward improving now? And why? Why? And lastly, what are the first 3 steps you can take now that will help you achieve this? As a reminder, a written document of this 8-step assessment to identify your level of occupational balance will be provided as a resource. Once you have reflected on the questions and completed the questionnaire, if you have identified any areas where changes need to be made, here are some tips to help you along the way. 1. Set SMART goals. These are specific, measurable, attainable, realistic, and time-bound goals. 2. Take things one step at a time. Occupational balance is a process, not a destination. 3. Reevaluate where you are on your journey every 2 or 3 months, so you stay on track. And lastly, here are some quick tips to balance your time. First, address your immediate commitments and crises to self, your family, and your work. Second, plan anything that is routine in your daily life. Examples include meals, house management, and personal time. Third, limit excess activities that take up your time, like social media or meetings and appointments that can be delayed or postponed. You may return to these when you have enough time to fulfill all your meaningful activities, including self-care. And lastly, avoid agreeing to commitments that are taking away from your areas of importance. Thank you for your attention during this presentation. We hope that the information provided was helpful to you.